California's troubled COVID testing lab will soon be shutting down. CBS13 has learned the state is terminating its $1.7 billion no-bid contract with PerkinElmer, the private company running the taxpayer-funded lab. Now, the Department of Public Health faced criticism for renewing that contract last year during ongoing state and federal investigations of the lab, investigations that were prompted by our whistleblower investigation.
Here's CBS13 investigative reporter Julie Watts.
The state's 45-day notice cites increasing COVID testing alternatives as the reason for terminating the COVID lab contract, and notably makes no mention of the state and federal investigations, which found the lab practices pose immediate jeopardy to patient health and safety, likely to cause serious injury, harm, or death to California patients. Findings the state hid from those patients and taxpayers as the investigations continued for nearly a year.
They're jeopardizing people's life.
Unlicensed lab techs asleep while processing COVID samples, test swabs found in lab restrooms, incidents of contamination, wrong results, and tens of thousands of inconclusive COVID tests. Those were just the first of many shocking public health failures exposed by whistleblowers from inside California's $1.7 billion COVID testing lab.
They really want public to know that this lab should not continue operating like this.
More than a dozen whistleblowers came forward last year to expose what they say the state tried to hide.
The public deserves to know what's going on in their state lab, and everybody deserves to have correct results.
The California Department of Public Health initially denied the allegations, calling our reporting irresponsible, then changed their response, acknowledging state inspectors had found significant deficiencies at the lab months earlier. They promised to make their investigation public, then refused to release it for 8 more months as problems continue.
Our positivity rate has increased over 1,000% with the state lab.
In the meantime, schools struggled with false positive COVID results from the state lab, keeping healthy kids quarantined for weeks, further impacting mental health.
This COVID just keeps taking stuff away from us,
Then we uncovered evidence of lab contamination, and the ripple effect widened, impacting travel and more.
People couldn't work.
Still, in May, the state continued implying the problems were exaggerated.
Some of them were wildly overstated.
We now know 1 week before that interview, federal inspectors issued yet another notice of lab deficiencies.
I have all the confidence that those issues have been resolved, and some of them were a bit, with respect, overstated.
3 days after that press conference, state inspectors sent this notice clarifying the lab was still not in compliance and the evidence of correction was not acceptable. Problems and investigations would continue for 6 more months while patients remained in the dark, and the state quietly renewed PerkinElmer's $1.7 billion contract, even though the lab failed to fulfill many requirements. And when the state finally did release those lab inspection records, they buried the link to those records at the bottom of a 10-page press release, which said the lab deficiencies had been resolved and claimed they'd had no impact on the integrity of the test.
That would be impossible. You just can't make a statement like that. It makes no sense.
This was not just oops, we made a minor mistake that didn't harm any patients.
Many in the laboratory community were shocked the state had allowed the lab to continue processing patient samples while failing to correct deficiencies without revealing the risk to patients.
Not how laboratories are supposed to operate in the United States.
In response, State Senator Wilk introduced 2 pieces of legislation. One protects whistleblowers who work for government contractors like PerkinElmer, which was given a $1.7 billion no-bid contract and then sued the whistleblowers who reported wrongdoing. The other is a constitutional amendment requiring approval from the legislature before the state can renew a future no-bid contract.
As much as people complain about the media has a purpose to be a watchdog on the government when they won't be a watchdog on themselves.
Yeah, some dogged reporting by Julie now. The state says, quote, testing will now be provided through a network of commercial partners. To see the story behind this 18-month-long investigation, we invite you to head to our website, cbs13.com/COVID Lab, to watch our full special report, The COVID Lab State Secrets Exposed.